Hello dear students, I congratulate you all to start new academic year and I wish you a good luck. Today we're gonna start our first lecture of radiotherapy. This lecture is considered for the fourth course of general medicine and for third course of stomatological faculty. The subject of our today's lecture is Introduction to Radiotherapy, Natural and Artificial Radioactive Elements. First of all, I will introduce key points to you. Our key points are radiotherapy as a science, history of radiotherapy, natural radioactive elements, artificial radioactive elements, and protective measures from damage action of ionizing radiation. As you know, medical radiology consists of two main parts, diagnostic radiology and radiotherapy. That is, radiology is a branch of medicine that uses imaging technology to diagnose and treat of disease. On diagnostic radiology, we use different types of rays with diagnostic aims. And the most common types of diagnostic radiology exams include X-ray methods, computer tomography, magnetic resonance tomography, medical ultrasonography. But in radiotherapy, we use different types of rays with treatment aims, especially malignant tumors. On medical radiology, we use from two types of rays, from ionizing and non-ionizing rays. In diagnostic radiology, we use from both types of rays, but on radiotherapy, we use just ionizing types of rays because they can make biological changes in our body. Energy emitted from a body or source that is transmitted through an intervening medium or space and absorbed by another body is radiation. Radiation is classified as you can see here, ionizing and non-ionizing rays. Non-ionizing radiation is longer wavelengths and lower frequency, lower energy, while ionizing radiation is short wavelengths, high frequency and higher energy. Ionizing radiation has sufficient energy to produce ions in matter at the molecular level. If that matter is a human, significant damage can result including damage to DNA and denaturation of proteins. In this picture, you can see different types of rays which are used in medicine. Ionizing radiation is a type of energy released by atoms that travels in the form of electromagnetic waves or particles. That's ionizing rays. They have two main types: photon rays or electromagnetic radiation and corpuscular rays. Photon rays are X-rays and gamma rays. Corpuscular rays are alpha and beta particles, neutrons and protons. The spontaneous disintegration of atoms is called radioactivity, and the excess energy emitted is a form of ionizing radiation. Unstable elements which disintegrate and emit ionizing radiation are called radionuclides. But non-ionizing rays are ultrasound waves, infrared rays and magnetic waves, and you know that these rays we use in diagnostic radiology. During interaction, ionizing radiation with living body tissue, and they can make biological stage. In this picture, you can see different stages, principle of different stages of ionizing rays. First is physical stage. On physical stage, the transfer of kinetic energy from ionizing radiation to atoms or molecules leads to excitation and ionization of these atoms or molecules. On physicochemical stage, the displays of absorbed energy of ionizing radiation into molecules and between them, formation of free radicals. Chemical stage, reactions between free radicals, reactions between free radicals and intact molecules, formation of molecules with abnormal structure and function. And finally, on biological stage, formation of injuries on all levels, from cellular structures to organism and population, development of processes of biological damage and reparative processes. Radiation damage starts at the cellular level. Radiation which is absorbed in a cell has the potential to impact a variety of critical targets in the cell, the most important of which is DNA. Evidence indicates that damage to the DNA is what causes cell death, mutation, and carcinogenesis. The mechanism by which the damage occurs can happen via one or two scenarios. First way is direct effects. Second way is indirect effect. Okay. First way is direct action of ionizing radiation, as you can see here. In this way, radiation may impact the DNA directly, causing ionization of the atoms in the DNA molecule. This can be visualized as a direct hit by the radiation on the DNA, and thus is a fairly uncommon occurrence due to the small size of the target. The diameter of the DNA helix is only about 2 nanometers. It's estimated that the radiation must produce ionization within a few nanometers of the DNA molecule in order for this action to occur. Second way is indirect action of ionizing radiation. Indirect action of radiation involves the transfer of energy to an atom with a subsequent decay to free radical spaces. A free radical is an electrically neutral atom with an unshared electron in the orbital position. The radical is electrophilic and highly reactive. Since the predominant molecule in biological system in water, it's usually the intermediary of the radical formation and propagation. That is, in this way, in second way, in indirect action of ionizing radiation, the radiation interacts with non-critical target atoms or molecules, usually water. This results in the production of free radicals, as you can see here, during interaction ionizing radiation with neutral water molecules. The result in the production of free radicals, which are atoms or molecules that have an unpaired electron and thus are highly reactive. These free radicals can then attack critical targets such as DNA. Because they are able to diffuse some distance in the cell, the initial ionization even does not have to occur so close to the DNA in order to cause damage. Thus, damage from indirect action is much more common than damage from direct action, especially for radiation that has a low specific ionization. During interaction, ionizing radiation with living body tissue, with cell, DNA is primary target for cell damage from ionizing radiation. Nucleic acids found in living cells are two types, DNA and RNA. They are complex macromolecules made of purine and pyrimidine bases on a backbone of alternating sugar and monophosphate molecules. The bases are nitrogen ring compounds. The carbohydrate sugar is either deoxyribose or ribose, 5 carbon sugars unique to nucleic acids. There is considerable evidence suggesting that nucleic acid, especially DNA, are the primary target for cell damage from ionizing radiation. Now I'm explaining about main aspects of ionizing rays. Ionizing radiation has been classified as followings. First, X-radiation. You know that X-rays we can use in medicine, in diagnostic radiology, and also in radiotherapy with treatment aims. On diagnostic radiology, X-rays are used in plain X-ray radiography, in fluoroscopy, on computer tomography, in different types of contrast investigation. X-radiation, they are photons with low energy in the range 120 electron volt to 120 kiloelectron volt. They have a shorter wavelength than ultraviolet rays and longer than gamma rays. X-radiation is also called Röntgen radiation, named after Wilhelm Conrad Röntgen, the discoverer of its existence and the man who named it X-radiation, the X standing for an unknown type of radiation. Next type of ionizing radiation is alpha particle. In this picture, you can see passageability of different types of ionizing rays. First of all, you can see alpha particles. Alpha particles are charged particles which are emitted from naturally occurring materials, for example, uranium, thorium, and radium, and man-made elements such as plutonium and americium. These alpha emitters are primarily used in items such as smoke detectors. In general, alpha particles have a very limited ability to penetrate other materials, as you can see here. In other words, these particles of ionizing radiation can be blocked by a sheet of paper, skin, or even a few inches of air. Next type of ionizing radiation is beta particles. Beta particles, which are similar to electrons, are emitted from naturally occurring materials. Such beta emitters are used in medical applications, such as treating eye disease. In general, beta particles are lighter than alpha particles, and they generally have a greater ability to penetrate other materials. As a result, these particles can travel a few feet in the air and can penetrate skin. And a thin sheet of metal or plastic or a block of wood can stop beta particles. Next type of ionizing radiation are gamma rays and X-rays. Gamma rays and X-ray consist of high energy waves that can travel great distance at the speed of light and generally have a great ability to penetrate other materials. For that reason, gamma rays such as from cobalt-60, are often used in medical applications to treat cancer and sterilize medical instruments. Gamma rays is widely used, are widely used rays in radiotherapy. And similarly, X-rays are typically used to provide static images of body parts and are also used in industry to find defects in wells. Despite the ability to penetrate other materials in general, neither gamma rays nor X-rays have the ability to make anything radioactive. Several feet of concrete or a few inches of dense material, for example such as lead, are able to block these types of radiation. That is, passage ability of X-rays and gamma rays is higher than alpha and beta radiation. And finally, neutrons. Neutrons are high-speed nuclear particles that have an exceptional ability to penetrate other materials. Of the 5 types of ionizing radiation discussed here, neutrons are the only one that can make objects radioactive. This process, called neutron activation, produces many of these radioactive sources that are used in medical, academic, and industrial applications. Because of their exceptional ability to penetrate other materials, can travel great distance in air, and require very thick hydrogen-containing materials such as concrete or water to block them. However, neutron radiation primarily occurs inside a nuclear reactor, where many feet of water provide effective shielding. In this picture, you can see main properties of ionizing radiation. Ionizing rays are not felt by human body. That's during investigation, during diagnostic procedures, and during radiotherapy. Human body can't feel interaction of ionizing rays. Passageability of them, of ionizing rays, depends on density or structure of subject, and that depends on atomic number or density of material. Passageability is different. For example, higher density structures, for example, such as bone and other calcified structures, they absorb ionizing rays, but less density structures, for example, air cavities, soft tissues, parenchymatous organs, passageability of ionizing rays through these structures is less, that they can't absorb ionizing radiation. Ionizing radiation can impact on photopaper. Also, they can transform air and gases to conductor, and they can change the passageability of some elements. Ionizing radiation, they have biologic effect. It is so important factor of ionizing rays. Just depend on these factors, this ability. We use them in radiotherapy, and a certain amount of heat energy is emitted during radioactive decay, and when affecting some elements, it creates fluorescence. That is, during interaction ionizing radiation with some elements, they can make lightness, and we name it fluorescence ability of ionizing rays. Okay, so radiotherapy is a clinical modality dealing with the use of ionizing radiations to treat malignant neoplasias. Since its inception, the goal of radiotherapy has been to cure cancer locally without excessive side effects. Our goal in radiotherapy is to deliver a safe, secure, and best technology available for the eradication of the tumor in the treated area with a focus on minimizing the potential side effects of treatment, that is maximal exposure of tumor tissue and maximal protection of surrounding normal tissue. Teamwork will always mean that a multidisciplinary approach in radiotherapy is mandatory, and the involvement of all the key participants in the treatment process is very important. The roles of some of the key players are stated here. As you can see here, the roles of radiation oncologists are advice about treatment options and consent for treatment, target and normal tissue delineation, prescription of radiotherapy, planning, review and approval, and other. The roles of radiation therapists are patient information and support, simulation, planning, producing and checking treatment plans, data transfer and monitor unit calculations, daily radiotherapy delivery, treatment verification, and monitoring the patient on a daily basis. And the roles of medical physicists are specification of equipment used in therapy and imaging, dosimetry assurance, producing and measurement and beam data analysis, checking treatment plans, and other. Radiation therapy works by damaging the DNA within cancer cells and destroying their ability to reproduce. When the damaged cancer cells are destroyed by radiation, the body naturally eliminates them. Normal cells can be affected by radiation, but they are able to repair themselves. Sometimes radiation therapy is the only treatment a patient needs. Other times it's combined with other treatments like surgery and chemotherapy. Radiotherapy is one of the most dynamic areas in oncology, with multiple benefits for patients. Radiation experts are an important part of multidisciplinary teams that successfully treat cancers, even in advanced stages with metastasis. Of the 100 patients diagnosed with cancer, 20% will be treated only by surgery, as you can see here, and 15% will be treated only by radiotherapy. Chemotherapy will only be given in 2 to 3% of cases. Combining these methods will increase the chances of successfully treating a cancer. In addition, with a 10% technology upgrade, the radiotherapy treatment success rate improves by 15 to 16.5%. Imagine what good outcomes we can achieve with only a few improvements in local therapies in the treatment of cancer at the population level. Radiotherapy can be applied to a wide variety of cancers. In almost any type of cancer, radiotherapy is recommended, but it depends on the stage and the condition of the patient. In our country, radiotherapy is provided in our National Oncology Center. Today, as a result of development process, all methods of radiotherapy are applied of the center, including two-dimensional radiotherapy, three-dimensional conformal radiotherapy, and brachytherapy. According to the Center of Oncology, an application of intensity-modulated radiotherapy, stereotactic radiosurgery, and radiotherapy methods will start on May 2013. Stereotactic radiosurgery is a form of radiation therapy that focuses high-powered X-rays on a small area of body. National Center of Oncology is also successfully realizing brachytherapy, which is commonly used as an effective treatment for cervical, prostate, breast, and skin cancer. Highly developed countries are applying all these methods to clinical practice so fast. Azerbaijan is among world leaders in this field. History of radiotherapy. Wilhelm Röntgen, professor of physics in Würzburg, Bavaria, discovered X-rays in 1895 accidentally while testing whether cathode rays could pass through glass. His cathode tube was covered in heavy black paper, so he was surprised when an incandescent green light nevertheless escaped and projected onto a nearby fluorescent screen. Through experimentation, he found that the mysterious light would pass through most substances and but leave shadows of solid objects. Because he did not know what the rays were, he called them X, meaning unknown rays. When Henry Becquerel investigated the newly discovered X-rays in 1896, it led to studies of how uranium salts are affected by light. By accident, he discovered that uranium salts spontaneously emit a penetrating radiation that can be registered on a photographic plate. Further studies made it clear that this radiation was something new and not X-ray radiation. He had discovered a new phenomenon, radioactivity. In 1898, the Curies discovered polonium and radium. It was the beginning of a knowledge era that started in 1903 with the first histologically proven cure of a skin cancer, followed by the cure of cervical cancer. In addition, in 1903, the Curies and Becquerel got Nobel Prize for their profound discovery. Radioactivity is a natural phenomenon that has existed since the origins of the Earth. It's present everywhere, in the water, the air, the soil, and the biota. The human being itself is radioactive. There are two types of radioactivity: natural radioactivity and artificial radioactivity, also known as induced or man-made radioactivity. Natural radioactive families. Three main decay changes are observed in nature, commonly called the thorium series, the radium series, and uranium series, and the actinium series, representing three of these four classes and ending in three different stable isotopes of lead. The long-lived starting isotopes of these three isotopes, respectively thorium, uranium, and other isotope of uranium. Natural radiation comprises cosmic radiation and the radiation arising from the decay of naturally occurring radionuclides. The natural radionuclides include the primordial radioactive elements in the Earth's crust, the radioactive decay products, and radionuclides produced by cosmic radiation interactions. Primordial radionuclides have half-lives comparable with the age of the Earth. Cosmogenic radionuclides are produced continuously by bombardment of stable nuclides by cosmic rays, primarily in the atmosphere. Artificial radioactivity, in other words, they produced radioactive elements that are not naturally radioactive. One important use of artificial radioactivity is the diagnosis and treatment of disease. In addition, the Joliet-Curie breakthrough helped lead to the discovery of nuclear fusion. Definition of artificial radioactivity or radiopharmacological preparations, and they are radioactivity produced in a substance by bombardment with high-speed particles, and we call a name induced or artificial radioactivity, and the husband and wife team of Irene Joliot Curie and Frederick Curie discovered this type of radioactivity, and they shared their discovery Nobel Prize in chemistry for this discovery. Okay, radioactive isotopes can be made by bombarding an element with a particle, and with alpha particles, protons, and electrons. In general, the probability of a reaction depends on the energy of the particle, and it is measured in the so-called reaction cross-section. It appears that neutrons with low energy in general have a large cross-section than fast neutrons. Main features of radiopharmacological preparations are organotrope, small half-life, non-toxic effect, and complete elimination from the body. Radioisotopes find use in medicine in 4 different ways. First, radioisotopes in radiotherapy. Emitted radiation used to destroy cells in conditions like cancer. Next, radioisotopes in diagnosis, or we name it radioactive tracers, especially for diagnosis of tumors, metastatic lesions. This type of diagnostic imaging is so important. Next, research, biological and medicinal studies by use of radioactive isotopes as tracers. And finally, sterilization, for sterilization of pharmaceutical and surgical instruments. They are also used. Radioactivity can be used in medicine and pharmacy in different areas. The first being radiology, in which an external source by radioactivity passes through a patient and radiation is absorbed by more dense tissues and not by less dense tissues, and an image is ultimately formed. You know that it is so important property of ionizing rays. And but in radiotherapy, which treats for tumors using an external source of radiation to try and ablate a tumor, this requires lots of radiation in very high doses. Nuclear medicine uses an internal source of radiation to be detected externally, unlike the 2 previously mentioned. A patient is injected with a radiopharmaceutical, which has a radioactive component that decays, and a pharmaceutical component which takes its desired organ. For example, iodine, radioactive iodine, used as a diagnostic aid for studying the function of thyroid gland. Also, this radioactive material used in scanning the thyroid for determining the size, position, and possible tumor location. And also radioactive iodine used in the treatment of severe cardiac disease, which reduces workload on heart, and radioactive iodine in thyroid carcinoma, in cancer. The isotope is used most frequently after the surgical removal of cancer to treat any residual tumor tissues. That is, radioactive iodine, these radioactive elements we can use in medicine, in diagnostic radiology, and in radiotherapy, especially for treatment of thyroid gland cancer. As example, radioactive gold is used in treatment of abdominal and pleural effusions associated with malignant tumors. It is given in the form of colloidal gold suspension. Gold also used, radioactive gold also used in treatment of uterus cancer and cancer of urinary bladder. Cobalt, radioactive cobalt, labeled cyanocobalamin, is used in diagnosis of anemia. Sodium iodine preparation finds use in treatment of thyroid disorders. Calcium is used to study bone structure and in carcinoma of bone. And finally, strontium is used in the diagnosis of superficial carcinomas. Radiation therapy has seen a dramatic development in the last 13 years. It connects with new delivery technologies, with improved imaging technology such as PET scan, magnetic resonance tomography, computer tomography, with new fractionation schedules such as single beam radiotherapy, hypofractionation, new combination therapies such as chemoradiation and molecularly target treatment options, and improved follow-up and patient survivorship care. Modern radiation therapy continues to progress at an unprecedented rate. The present rapid evolution is primarily related to the very significant advances in the modern technology of radiation oncology. This development is strongly linked to the evolution of computer technology and the corresponding advances in diagnostic imaging equipment. New buzzwords have evolved in the last 2 decades, such as 3-dimensional conformal radiotherapy, 4-dimensional radiotherapy, intensity modulated radiotherapy, tomotherapy, treatment gating, breathing control, adaptive radiation treatment, inverse treatment planning, multi-leaf collimation, and image segmentation. Okay. The goal of radiotherapy is to deliver as much dose to the tumor while sparing normal tissue. It's basic principle of radiotherapy. That's to deliver as much dose to the tumor while sparing normal tissue. Technological advances incorporating new imaging modalities, more powerful computers and software, and new delivery systems such as advanced linear accelerators have helped achieve this. 3-dimensional conformal radiotherapy. 2-dimensional radiotherapy using rectangular fields based on plain X-ray imaging has largely been replaced recently by 3-dimensional radiation therapy based on CAT scan imaging, which allows accurate localization of the tumor and critical normal organ structures for optimal beam placement and shielding. The aim is to deliver radiation to the cross-tumor volume with a margin for microscopic tumor extension called the clinical target volume, and therefore the imaging uncertainties from organ motion and setup variations called the planning target volume. Intensity modulated radiotherapy allows the oncologist to create irregular shaped radiation doses that conform to the tumor whilst simultaneously avoiding critical organs. Intensity modulated radiotherapy is made possible through inverse planning software and by computer controlled intensity modulation of multiple radiation beams during treatment. This method is now available in many clinical departments and can be delivered by linear accelerators with static or dynamic multi-leaf collimators or tomotherapy machines. This has allowed improvements in the therapeutic ratio for several tumor sites such as head and neck cancer, prostate cancers, and other types of malignant tumors. Image-guided radiotherapy. As treatment margins become more conformal, the potential to miss tumor due to organ motion and patient setup variations become greater. When critical structures are close to the tumor, a slight positional error may also lead to inadvertent radiation of the normal organs. Image-guided radiotherapy allows the detection of such errors by information acquired through pre-radiotherapy imaging, which allows for correction. One such example is with daily cone beam CAT scans acquired before each treatment. The improvement accuracy has made dose escalation feasible, and this has allowed an improvement in the treatment ratio for several tumor sites, such as head and neck cancers and prostate cancers. And finally, stereotactic body radiation therapy. The above technological advancement, such as three-dimensional radiotherapy, intensity-modulated radiotherapy, and image-guided radiotherapy, have enabled single-beam radiotherapy, which precisely delivers very high individual doses of radiation over only a few treatment fractions to ablate small, well-defined primary and oligometastatic tumors anywhere in the body. Due to the high radiation dose, any tissue immediately adjacent to the tumor is likely to be damaged. However, as the amount of normal tissue in the high dose region is small and non-eloquent, clinically significant toxicity is now low. Single beam radiotherapy has shown excellent results in the treatment of early stage non-small lung cancer in patients unfit for surgery. Other tumors include in the prostate, head and neck, hepatic, renal, oligometastasis, and pancreatic cancer. In this table, you can see the major phases of major technological developments in radiation oncology. As you can see here, there are 5 phases of this process. First step begins from 1895 to 1940s. Main technology of this phase is X-rays with 100 to 400 kilovoltage. Important issues are non-uniform doses to deep-seated tumors, skin toxicity, and bone toxicity. Second phase begins from 1950s. Important technology of this phase is cobalt-60 unit, sometimes linear accelerators with from 4 to 8 mega electron volt. So important issues are megavoltage photons provide skin sparing, improve dose uniformity in the target, and reduce dose to normal tissues. Also increased manual treatment planning. Next phase begins from 1960s to 1970s. Multimodality, the technology of this phase technologies are multimodality, Linux linear accelerators, computerized radiation treatment planning systems, and simulators. Important issues are increased availability of linear accelerators, increased use of computerized treatment planning, introduction of simulators, increased physics human resource to support the technologies, and other. And the next phase begins from 1970s to 1980s. Important technology is computer tomography combined with three-dimensional treatment planning. Important issues are improved targeting, reduced complications, and improved dose computations. And finally, phase begins from 1980s to present. Important technologies are development of computer-controlled dynamic treatments, such as intensity modulated radiotherapy, further improvements in imaging with computer tomographic simulators, magnetic resonance imaging, PET and PET scan. Important issues are allows dose escalation with increased probability of tumor control and reduced probabilities of normal tissue complications. Okay, and there are still many advanced tumors which are diagnosed late, and then even if they are still local or regional, can't be cured with radiotherapy nor with any other therapy. Advanced cancer is a term used to describe cancer that is unlikely to be cured. It may be primary or secondary cancer. Although medical treatments may not be able to cure advanced cancer, some treatments may still be able to slow its growth or spread, sometimes for months or even years. Palliative care can also help manage cancer signs, which may include pain and can reduce side effects from cancer treatments. At any stage of advanced cancer, a range of other palliative care services can enhance quality of life. Some people's cancer may be advanced when they are first diagnosed. For others, the cancer may spread or come back after initial treatment. Advanced cancer usually can't be cured, but it can often be controlled. For some people, improved treatments can help manage the cancer and relieve side effects, allowing people to live for a long time, sometimes for years, with a good quality of life. In this case, the cancer may be considered chronic. Possible regions of pointing of ion therapy include in patients at this stage, advanced tumors have a higher fraction of hypoxic and aggressive stem cells that are directed towards survivors. They tend to resistant radiotherapy, invasive and other options. Advanced tumors are generally large and contain more stem cells that need to be eliminated, and advanced tumors have a large propensity for local infiltration and regional and distant spread. Thus, during treatment, patients with advanced cancer, these aspects are so important. And finally, I will explain about protective measures from damage action of ionizing rays. As you know, it is clear that ionizing rays they can make biologic changes in our body after different mechanisms, principles of physical and chemical changes. They can make biological changes in our body. People are exposed to natural radiation sources as well as human-made sources on a daily basis. Natural radiation comes from many sources, including more than 16 naturally occurring radioactive materials found in soil, water, and air. Radon, a naturally occurring gas, emanates from rock and soil and is the main source of natural radiation. Every day, people inhale and ingest radionuclides from air, food, and water. People are also exposed to natural radiation from cosmic rays, particularly at high altitude. On average, 16% of the annual dose of background radiation that a person receives is due to naturally occurring terrestrial and cosmic radiation sources. Background radiation levels vary geographically due to geological differences. Exposure in certain areas can be more than 200 times higher than the global average. Human exposure to radiation also comes from human-made sources, ranging from nuclear power generation to medical uses of radiation for diagnosis or treatment. Today, the most common human-made sources of ionizing radiation are medical devices, for example, including X-ray machines. But do we need radiation protection, and why we use protective measures from damage action of ionizing radiation? And several biological effects can result from ionizing radiation. These can be due to direct or indirect mechanism, and they can be acute or delayed. Acute effects occur with exposure to high-level radiation. Delayed effects may appear after a long time and include cancer, genetic effects, effects on the unborn child, and other effects such as cataracts and hypothyroidism. Based on our current knowledge, no level of exposure to radiation can be described as absolutely safe, and no level is uniformly dangerous. Radiation doses have to reach a certain level to produce acute injury, but not to cause cancer or genetic damage. No biological effects in individuals have ever been documented as being due to levels of ionizing radiation employed for medical diagnosis. Observed doses from nuclear medicine procedures are very low. Fear of radiation must not be permitted to undermine the great value of radiation in clinical practice. However, safe handling of all levels of radiation is important to prevent or minimize possible biological effects. In order to protection from damage action of ionizing radiation, so important principle is ALARA principle. ALARA. The meaning of these principles, of ALARA principle, is law as reasonably and achievable. The principle of radioprotection stating that whenever ionizing radiation has been applied to humans, animals, or materials, exposure should be as low as reasonably and achievable. It is fundamental to the principles of radiation protection. This principle means that even if it is a small dose, if receiving that dose has no direct benefit, we should try to avoid it. To do this, we can use three basic protective measures from damage action of ionizing radiation: protection with time, protection with distance, and protection with shielding. That is, in medicine we use from three main types from radiation protective methods: protection with time, with distance, and with shielding. First of all, I will explain about protection with time. That is, the exposure is to be kept as short as possible because the exposure is directly proportional to time. Thus, during investigation or during treatment with ionizing rays, the amount of radiation an individual accumulates will depend on how long the individual stays in the radiation field. Therefore, to limit a person's dose, one can restrict the time spent in the area. How long a person can stay in the area without exceeding a prescribed limit is called the stay time. Next method of protection is protection with distance. It means distance from the radiation source should be kept as great as possible. The amount of radiation an individual receives will also depend on how close the person is to the source. And in this aspect, the inverse square law is so important. Point sources of X-ray and gamma radiation and all ionizing radiation follow the inverse square law, which states that the intensity of the radiation decreases in proportion to the inverse of the distance from the source squared. Okay, and finally, important protective measures from damage action of ionizing radiation is shielding. Shielding materials, they are lead protective shield. In this way, lead protective shield is placed between the X-ray tube and the individuals exposed, absorbing unnecessary radiation. And when reducing the time or increasing the distance may not possible, one can choose shielding material to reduce the external radiation hazard. The proper material to use depends on the type of radiation and its energy. You know that one of so important properties of ionizing rays is that passage ability of them depend on structure and density of environment or investigated area. You know that atomic number of lead is more because lead absorb X-rays, and therefore shielding materials they are prepared from lead. Alpha particles are easily shielded. A thin piece of paper or several centimeters of air is usually sufficient to stop them. Thus, alpha particles present no external radiation hazard. Beta particles are more penetrating than alpha particles. Beta shields are usually made of aluminum and brass, plastic, or other materials of low atomic number to reduce the production of Bremsstrahlung radiation. All things considered, I have explained the aim and targets of radiotherapy, its role in medicine, and main principles of application of ionizing radiation. You have already been aware that radiotherapy methods are important way of treatment of malignant tumors, and radiation therapy has now become the most important non-surgical modality in cancer. Over 15% of all cancer patients now receive radiotherapy at some point during the illness. Radiation therapy has increasingly replaced surgical resection for primary control of a variety of solid tumors. Combinations of surgery and radiotherapy are increasing used, for example, in the preferred management of most cancers of the breast by wide local surgical excision, breast preservation, and postoperative radiotherapy. Recent technical advances, both in imaging and therapy beam precision, have greatly improved the therapeutic rate and accuracy of modern radiotherapy. But remember that sometimes for treatment of non-malignant diseases, radiotherapy is used also. I will talk about principles and methods of radiotherapy, application of its for treatment of different diseases in next lectures. And this science is interconnected with oncology, and in all cases effectiveness of provided therapy depends on right choice of method. You will be shown videos about radiotherapy methods in practice lessons. And the lecture is ended. Thank you for your attention. If you have any question, don't hesitate to mail me. Thanks for your attention.